So let's have a look at fissure protection. The first thing we should do, and we should do this every single time we look at lectures for this subject, is ask ourselves, which of the intended learning outcomes are we dealing with today? So you'll remember these are the 6 intended learning outcomes from POH, what you need to be able to do, say, and value. Which of these do you think we will be examining today, or fissure protection? Where does it sit within our ILOs? Pause for a moment to think. Pause. Okay. You've probably correctly indicated that it could be part of 3 of our intended learning outcomes. The first is explain the basic process for the prevention of oral diseases. And as we will discover, fissure protection is about preventing oral diseases or preventing the progression of oral diseases. So it fits very nicely here with ILO 3. Also, it fits with 5 and with 6. It fits with 5 because 5 is all about selecting materials and medicaments. Those are materials or drugs or whatever it is that are required to perform basic dental procedures. And then our list of dental procedures here, you'll see that pit and fissure, fissure protection is one of those procedures that you will be identifying materials for. And 6, in a simulated clinical environment, you will be doing a number of basic dental procedures, and we'll be practicing fissure protection in the simulated laboratory environment. So what you should be doing immediately is saying all 3 of these ILOs are where I'm locating what we're talking about today. And as I study the materials around fissure protection, I should be keeping in mind that I'm addressing 1, 2, 3 of the intended learning outcomes. Now, for each of our sessions, we will also have a set of intended learning outcomes that sit below the subject intended learning outcomes. So these are the ones to focus on for that week. And again, when you come to do your study, when you're doing your reading, when you're reviewing your skill development, you should be coming back to these and saying, at this level, am I able to do, say, or be able to justify or value these particular things? So let's have a look at these in detail. The first today is to compare and contrast fissure protection and pit and fissure sealants. So fissure protection is an overarching term. A pit and fissure sealant is a particular procedure that fits under the term fissure protection. The next one is to identify clinical indications for fissure sealants. Now, when I say clinical indications, I mean be able to identify scenarios or teeth where a fissure sealant application would be useful. So that's what's meant by clinical indications, or it is clinically indicated that we would do these sorts of things. The third one is to identify the types of materials, and you can see this feeds back directly to one of the subject level intended learning outcomes. So be able to identify the types of materials that are commonly used for fissure protection. The next one is to identify benefits and limitations of the materials that we use. That should read in fissure protection. So there are pros and cons to different types of materials. Some have moisture, are very sensitive to moisture, for example, and you need to be aware of that when you're selecting those materials for particular clinical cases. And the last session ILO is to describe the clinical procedure for the safe application of fissure protection therapy or a sealant. So just to draw your attention again to the underlying words, they are the action words or the verbs. Those are the things that you should be able to do in order to be successful in fissure protection for this subject. Now we're going to be looking at some new terms today in this video, and you'll also see these new terms emerging through the course as well. Many of these terms you will learn in the subject ILOS with Dr. Graham, but they relate to parts of the teeth, they relate to the types of the teeth, and they relate to some of the elements of disease. Smooth surface lesion, for example, is a particular type of disease presentation on a tooth surface. And they will also relate to things like materials, the names of materials. So these are some of the terms that you should probably pause and maybe do a Google search if you're unsure of what they mean. We'll be coming back to them, but these are some of the terms that you should learn and commit to memory. So memorize them at that low level of Bloom's taxonomy. What are these things? Don't just move beyond them without knowing what they are, because you'll need to revisit them over and over again. So I'll leave you with those terms. You can pause the video now and Google search each of those terms. So let's move on now to fissure protection and why fissure protection is important in clinical dentistry. Here we have a cross section of the tooth, which I think I've shown you before, and it's magnified, so it's a big giant picture of a tooth, and it's been cut down the middle or sectioned. And what we can actually see here on the biting surface is this developmental pit or fissure, and these are naturally occurring features of the teeth, which Dr. Graham will talk about in detail. But it's these naturally occurring pits and fissures that become problematic in relation to dental decay, or, to use a more scientific term, dental caries. The reason these areas are problematic is because they are protected areas. They're areas where bacteria and biofilm can collect, and they're areas where it's very difficult for the average person to remove plaque and bacteria biofilm from these areas on a daily basis. I'll show you some pictures in a moment that just demonstrate how difficult that is. But these are, as I said, these are magnified, so these pits and fissures are very small, but they can be very deep and tortuous. And plaque manages to find its way into these grooves and can sit undisturbed in these little protected areas. The sugars that we then put into our mouth can be used by those bacteria to then destroy the tooth surface around it. So when we're talking about how to protect people's teeth from disease, we need to consider what we might do in these areas on the tooth surface to reduce that risk of disease. And one thing we can do is called fissure protection. And fissure protection is a global term that really is an umbrella for anything that we might do to protect this part of the tooth from decay. Okay, so it could be that we apply a chemical to this part of the tooth that strengthens the tooth. It could be that we place a material across the entrance to this fissure to occlude the fissure, and that is the fissure sealant. Each of these things can protect the area from tooth decay or dental caries, and therefore is referred to as fissure protection. The specific things we do to protect the fissure then have different names. And what we will be looking at specifically today is a treatment called a pit and fissure sealant. And these are one of the number of things we can do to protect fissures, but as I said here, perhaps the most commonly used fissure protection technique. We'll talk about that in detail. So if we look at this photograph in the top of the screen here, you can see that there is a number of grooves or fissures in the biting surface. This is the occlusal or biting surface of the tooth. These are the areas, if you look in your own mouth at your own teeth, if they're not filled already, you will see these grooves on the biting surface. These are the areas that are commonly more at risk of tooth decay. And we can see here a scanning electron microscopy of the same tooth surface, which just shows in a lot of detail how tortuous this surface actually is. It looks quite smooth to the human eye, but when you zoom in on it, you can see that it's actually covered with little nooks and crannies that could actually be areas for plaque to hide. However, it's these main fissures, what we call the main fissure pattern, where we see most risk of disease occurring. Now, this is a magnified picture of a tooth surface here, and these funny looking things here are actually the bristles of a toothbrush, so it's been magnified significantly. Now, the thing to note here is that this is the fissure or the pit, the developmental pit in the surface of the teeth, and you can see how ineffective even a single filament of the toothbrush would be in penetrating to the base of this fissure. So simple toothbrushing does not effectively remove plaque from the very base or depths of these pits and fissures. And that's why we see, even in some people who brush their teeth daily or twice daily, we still see decay occurring in some cases in pits and fissures in those teeth. We know from the literature, we know from examining populations that it's those occlusal surfaces or the biting surfaces of the teeth that are most at risk of tooth decay. And that's because of those anatomical features that are very difficult for people to clean. So this is the area of the tooth that is most likely to decay. And when we look at all of the teeth in a person's arch, it's these biting surfaces of the back teeth which have occlusal surfaces and at most at risk. The front teeth, or the anterior part of the mouth, have less of these pits and fissures. But the thing to remember is it doesn't matter what surface of the tooth the pit and fissure is on. If there is a pit and fissure there, if there is plaque in that pit and fissure, and if there is sugar going into the mouth, then any tooth can decay. But these ones are the ones that are most commonly affected. Now, we know that there is significant protection offered by pit and fissure sealants. The literature, such as this review here by Professor Lawrence Walsh, shows that fissure sealant programs are effective, worthwhile, and actually cost effective in reducing or preventing dental decay in high-risk children. So they are very effective in reducing dental decay in a cost-effective way. Another study by the Cochrane Review, which is the highest level of evidence that we have in science. These Cochrane reviews summarise all of the scientific literature, and this particular paper in 2004 said that there was significant reduction in dental decay or dental caries. And here they've summarised all of the studies to say that on average there was a reduction in dental caries of 86% at 12 months. And then there was a slow drop off in the reduction. But 86% in that first year after a fissure sealant is placed, those teeth were protected from dental caries. So quite significant preventive gains from fissure sealants. Here is a simple diagram that shows the fissure sealant in place. So our simple anatomy of the tooth here shows the enamel, the outer layer of the tooth, and you can see a little bit exaggerated just for the purposes of this diagram, but you can see a deep pit or fissure into the tooth. Underlying the enamel is the dentine, which is not quite as strong or hard as the enamel, and then here the pulp of the tooth. And this is the area where plaque will accumulate, and if decay is allowed to happen in this part of the tooth, it can very rapidly destroy the dentine and cavitate. So the fissure sealant is designed to occlude, to close up the entrance to that pit or fissure, so that plaque can't make its way into that pit. And clinically, this is what we see with fissure sealants in the mouth. So you can see here a permanent, a set of permanent teeth from 6 right across to the 6 on the other side. And you can see that in this case the practitioner has made a decision to fissure seal the occlusal surfaces of the teeth. You can see the slightly whiter material against the less white enamel there. But all of these teeth have been effectively protected with these fissure sealant applications.